both the healthcare system and the housing system are coming to similar conclusions from different directions. In the housing system, they often talk about critical time interventions. In the healthcare system, we often talk about teachable moments. And it's about seizing the opportunity when somebody is at a turning point in their lives. And in a hospital setting, for a homeless person with lots of complex things going on, that can be a brief moment of relative calm when you're safe, you've got a roof over your head, hopefully any addiction problems are being addressed, your mental health problems are being thought about, and your physical health is being treated. That can be a moment for that person to reflect and think, where am I going? Where would I like to go? What changes would I like to bring about? The key intervention in those situations is to think about it early enough. So if you're trying to address those things just after you've handed the person a bag of tablets and told them it's time to go, it's really too late. You really need to address that as you're admitting the person to the hospital. So it needs to be part of that initial assessment. Here you are, welcome to the ward. We need to start thinking already about what's going to happen when you leave the hospital. Do you have somewhere safe to go when you leave?
Anyway, they've set these amazing standards, and I chipped in a tiny weeny bit to the hospital, the secondary care side of it, and we worked out a sort of an idea for what all hospitals could do in secondary care. I mean, a lot of it is primary care based, of course, because that's where a lot of the work goes on, but secondary care, it's amazing because the patients just come to us, and they'll come to us and they know they won't be turned away. And so here come all these homeless people who are sick into hospitals. So hospitals are ideally placed to help them, and using these standards produced by the faculty, that is your blueprint. That's what you need to do. Make sure you adhere to those standards and you won't go wrong. And of course, what we've got to try and do is enforce those standards. At the moment, they're a great recommendation. But, it's not rocket science and none of it is impossible to achieve. So if you want to set something up where you are, get hold of a copy of the standards, get in touch with the faculty. I'm more than happy as well. I also work at the Royal College of Physicians on this. We can guide people how to start.
In 2017, there was a new bill put through Parliament called the Homelessness Reduction Act. And it recognised that in order to address the issues of homelessness, there needed to be a more formal law passed by Parliament. That led to a couple of key changes. The first was mainly placed on local authorities, and that meant that local authorities who provide housing and social care and lots of other locally based services had a greater requirement to act on people, not just who are homeless immediately, but who were at risk of homelessness within the next 56 days or about 2 months. That law then extended to something called the duty to refer. The duty to refer came into effect in October 2018, and that placed additional statutory responsibilities, so legal responsibilities, on a range of public bodies, including the NHS, social care, prisons and probation, to do more to help people who are homeless attending their public service. So in the NHS, acute services like A&E departments, urgent care centres and hospital wards are now required by law to make a referral, as long as the patient consents, to the local housing authority if that person is homeless or at risk of becoming homeless. And it has been an interesting process because the law arrived what felt like very suddenly, and I think a lot of organisations weren't prepared for it. But as time has gone on, we've realised the value and importance of this law, not just in terms of the very simple act of referring somebody if you get down to the real basics, but of the opportunity that it gives us to identify people who are homeless, to offer them a range of interventions, not just a housing referral, but maybe referrals to other services that can support them. Today, for example, we're recording this in the Crisis Skylight Centre in Oxford. This is an amazing support service that helps people who are homeless. It enrolls them into training programs, supports them through education, can signpost them, help them with housing. So it forces us to think more broadly about how can we improve care for people who are homeless attending hospitals, and how can we link with other services that can help us deliver that care?
People again will think, oh crikey, that's too much work, I don't know how to do that. Do you know what? Simple system, once you've got it in place, it's 30-second job. Are you homeless or at risk of being homeless? You know, a couple of quick questions about address, do you give your consent? And then either an email or a phone call, and you're done.
One of the key problems with the duty to refer is that it doesn't yet apply to primary care. And that's one of the limitations, because we know from recent research actually done by Crisis and presented at Parliament that one of the main places that people who are homeless or at risk of homelessness go is to their GP. The next most common place is to hospitals. Although the law doesn't yet extend to primary care, there is no reason why primary care staff and community-based workers can't use the duty to refer, and there are simple referral forms available on the Pathway website, on the Department of Health website, that they can just download and use straight away to help their patients.